hope you all have enjoyed 2 fabulous days of very high substantive programming that really outlines how far this industry has come, identified our best practices, and recognized some of our leaders. And certainly we're going to do that here in a few minutes. I want to just do a couple of minutes of housekeeping with you. First, I want to thank some of our sponsors. All of our sponsors are listed on page 9 of your program guide, but there are 3 that I specifically want to recognize for some very high profile and activities they hosted for us. First of all, Health Fitness. Those of you who are on Twitter, and I know there's a lot of you, we have Health Fitness to thank for our social networking this week, and they have been tweeting out so many concepts and ideas and comments from this conference. At last count, we had reached over 20,000 individual people through some of our tweets, so we're very excited about that. I also want to thank Healthy Roads. Healthy Roads sponsored the app, and this is the first time that we have had a conference app. It has been an incredible tool for connecting our attendees, our exhibitors in the solution zone, our presenters, and getting out some of the publications, the research publications that the Care Continuum Alliance has released this week. So we really appreciate that support. I'd love your feedback on how we can continue to build out the app in future years and make it a more robust tool for our attendees and our exhibitors. Finally, I want to thank Inovalon. I know that you have name badges on them. If you look closely, there's a jump drive, a stick attached to the lanyard. It has all of the presentations on it. So you've got those presentations in 2 places. You've got them on the app, and you've also got them on your lanyard. So don't throw away your lanyard if there was a presentation that you were specifically looking for. And again, thanks to Inovalon for that sponsorship. One additional housekeeping, we have our annual Care Continuum Alliance business meeting. That will take place immediately following this plenary session in room 212, 2:45 p.m. this afternoon in room 212. If you are a member of the Care Continuum Alliance, and if you're not, you should be, but if you are a member of the Care Continuum Alliance, please join us at that meeting as we ratify the new slate of officers, new board members, and some of the new bylaws changes that we have developed to help this organization continue to grow and serve this industry as well as we are. So I also want to recognize some very important individuals for the success of this year's event. As I mentioned in my opening remarks yesterday, we had an entirely new format for this event, a juried awards conference. We brought together the high substance of our concurrent sessions with our awards programming. We had 15 outstanding individuals sit through every one of our 25 nominee sessions. I want to recognize those judges if they're here in the room, and I'm going to read their names because they are an incredibly impressive group of individuals. We have Pam Allweiss from the Centers for Disease Control and Prevention, Bob Berenson from the Urban Institute, Sue Felt-Lisk from Mathematica Policy Research, Christine Ferguson from the George Washington University Stop Alliance, Genevieve Kertenet from the Beacon Community Programs, Paolo Machado from Health Innovation Partners, Marcy Nielsen from the PCPCC, Jerry Noyce from HERO, John Robicher from the National Association of Chronic Disease Directors, Abby Rose, the Office on Smoking and Health at CDC, Joachim Roski from Booz Allen, Jan Sidoroff, Alan Spielman from URAC, and Marshall Voda from Leverage Health Solutions. Please join me in giving a round of applause and appreciation for the important work. I also want to stress that we had 25 outstanding nominees for these awards that we are about to present. These nominees were subjected to a very rigorous peer-reviewed selection process, and the programming committee that met in February of this year selected them as the outstanding leaders in our field who had brought forward innovation and best practices that we could learn from and build upon and move forward. So thank you to the 25 organizations who presented. We appreciate your contributions, and we look forward to continuing to represent you in the future. Now, I would very much like to welcome to the stage to join me our current board chair, Chris Cologne, with Predilytics, and our incoming board chair, Fred Goldstein, who is with U.S. Preventive Medicine. I have the pleasure of working with Chris and Fred, and I also have the pleasure of presenting the following awards with them. So please join me in welcoming Chris and Fred. Thank you so much. The first award that we will present this afternoon is in the Advancing Wellness track. I am delighted to report that the recipient of this award is Dr. Ron Lepke with U.S. Preventive Medicine for his work in the advancing wellness area. Unfortunately, Dr. Lepke is not able to join us, but his colleague Colleen is going to accept the award on his behalf. Colleen? Thank you so much, Colleen. Thank you. We have one award that we're going to be presenting. All of the awards are going to be engraved with the name and company logo of the winners of the award, so don't let that leave the stage. Yeah. The next award is in the Collaborative Strategies track, and we are honored to present this award to Ron Guziak with Sun Health Solutions and his colleague Jennifer Drago, also with Sun Health. Sun Health is an assisted living and retirement community, a series of communities in Surprise, Arizona, and we are honored by their participation and their advancements for population health management. Ron and Jennifer. Nice try.
Security.
Our next award is in the track called Expanding the Evidence. This was a very important track in which we recognize the importance of peer-reviewed literature in creating the value proposition and the evidence case for population health management strategies. I'm honored to present this award to Devin Casagara, Dr. Casagara with the Oregon Health and Science University, and Jan Berger, Dr. Jan Berger, Chief Medical Officer of SilverLink Communications. Neither Dr. Casagara nor Jan are here with us at this point, but we do have some of their colleagues from SilverLink who are here to accept the award, and we are honored to present to them for their work. So please join me in congratulating them. Great, thank you very much. The next award is presented in the Innovations in Care track. This award recognizes advancements in program design and delivery that perhaps don't have the level of evidence base or peer-reviewed literature behind them, but we believe are very promising practices. We are honored to present this award to Dr. Darren Schulte with Apixio. He's the Chief Medical Officer of Apixio. And while Dr. Schulte is no longer here in the conference with us, we do want to congratulate him and thank him for his contributions. There is no one here from Apixio, so please a moment of congratulations to Darren. Great. Thank you so much. The next award is in the Measuring Value track. This is a very important category and very much builds on the work that the Care Continuum Alliance has undertaken in our quality and research agenda over the past 7 years. Much of the work that we have undertaken in that world at CCA has been led by this individual, and we are honored to recognize his additional work on behalf of his own company, Alere. Dr. Gordon Norman is the recipient of this award. Thank you. We have one final award. This is an award for Outstanding Poster. We did have a number of incredible posters. We had 12 posters in the Poster Pavilion this year, and I'm delighted to present this year's award to a representative from Crane-Staywell, Sue Milijovic. Thank you so much, Sue, for your work, and please come up and receive your award. another round of congratulations for all of our awardees today. Thank you so much. So in my opening remarks yesterday, I kind of highlighted the arc of our plenary sessions. We started yesterday with Jan Sidoroff and Joe Coughlin and their excellent recap of how this industry has evolved over the last 15 to 20 years, where we've been, what we've learned, how we've moved forward, and the great achievements we've had, particularly around patient engagement, developing patient trust, and improving health outcomes for those populations. This morning, we had an incredible plenary session where we heard from the community level and how these communities, particularly through the Beacon program, are working to change healthcare delivery within their communities and some of the specific challenges they have in implementing health information technology and then using that technology to better serve their communities and improve patient care. Today, this afternoon, we've just recognized our leaders in our field, and we've recognized the accomplishments that they have given us, the contributions that they have given us to advance our field. Now we're going to look forward a little bit. We're going to take some time and build on the energy we've had over the last 2 days to really think about what's next for us. What are the future challenges going to be, and how can we work to continue to advance this industry, to continue to serve patients, and to continue to improve health outcomes and keep healthcare costs down. I'm honored to have with us today a recognized leader in business to talk with us about how our health industry can continue to perform and improve in this way. Jay Walker is curator and chairman of TEDMed. TEDMed is a global community of people who passionately believe that the future of health and medicine is here. And as a sole licensee of the world-famous TED organization, TEDMed organizes the nation's only conference that brings together thousands of medical and non-medical leaders from every sector of society. I have to tell you that I attended TEDMed in Washington, D.C. this past April, and I've said this to Jay and I've said it to the others. I blogged well. It really changed my thinking about conferences, about healthcare, about exchanging ideas with leaders, and how we think about things outside the box. It was one of the reasons that I was so passionate and persistent in inviting Jay to speak with us today, and I'm so excited to welcome him to the stage and invite him to share with you his vision for how we move forward with healthcare. Please join me in welcoming Jay Walker.
Good afternoon, ladies and gentlemen. So today's problems in health and health care are so complex and have become in so many ways so overwhelming that most of us automatically default back into our own areas of expertise when the world outside is just too confusing. And as we heard earlier, boy, the front lines of health and medicine aren't just changing. They're changing so fast that even the changes themselves are changing while they're being deployed. So when we sit back here and say, how do we anticipate a future and how do we prepare for it, we're stuck with the fact that the current world is so complicated that we want to draw away from it, lean back, and go back to our own expertise. And the problem with falling back to our own expertise, even though it's natural, is that we tend to stay in our own silos and we tend to talk to our own experts. And when you do that, you end up missing the extraordinary power of connecting to people who are not like you. And I don't mean connecting to patients or connecting to customers. I mean connecting to people that are completely in different fields than you're in, or connecting to people who think about problems differently, approach problems differently, and even understand problems differently. When you miss that, what happens is you end up in your space, comfortable, but really not making the kind of progress that ultimately you're going to have to make to keep up with the world that's changing faster and faster. That's part of the reason why, as you heard Stacy mention, I run a conference. It's really a community of people called TEDMed. And TEDMed is a community of about 2,000 people that gather once a year at the Kennedy Center in Washington, D.C. for 3.5 days. and about 30,000 people online at medical schools, teaching hospitals, and health and wellness facilities all across the country to participate. And what makes it different here is, unlike almost every other conference which is focused on a field or a set of subjects, it's just the opposite. We bring together people from health and medicine, but we bring together business people, technology people, government. We bring together people from law, from the military, from the media, from the arts. And we bring them together for 3.5 days live, and we bring them together on the web year-round because we're looking to try to see if together we might be able to see a little bit better about what the future of health and healthcare might look like. And so Tracy asked me to come and share today. Asked is probably the wrong word. Tracy commanded me to come here today. Okay, I think that's more close. Yeah, I think that's right. Okay, and to share with you, if I could, sort of what we as a community see and how that might help people in population health management sort of see a little bit differently the future that you're heading for and the future that you're helping to create in a very real way. So we at TEDMed certainly see a health revolution coming in the United States and the world, but definitely the United States first. Note that I said care revolution, although that is coming too. We see a health revolution coming. Now the difference to us is simple. Health care is what happens in the doctor's office when you engage somebody in the health care system. We'll call that, in its broadest sense, health care. And that's about 2% of your life, if you're fortunate, all right, on average. So the other 98% of the time, we call that health. 98% of the time, we're not in the health care world, we're in the health world. And of course, your health happens when you decide to take a walk. Your health happens when you have a good emotional relationship with your friends and your family and your loved ones. Your health happens when you eat a cheeseburger or not. Your health is happening to you all the time. And you're not only shaping it, but you're co-evolving it in a very real sense. And we, of course, have learned more and more in the sciences how much we as individuals affect our health, something I don't need to tell you. But here is the first, perhaps a little bit of a surprise, because you come from the population health world, which is, of course, in the midst of an extraordinary transition in health care. But today's health revolution is not being led by healthcare professionals, not by a long shot. It's not being led by doctors, personnel. It's not being led by a lot of the typical actors in what we thought of as the health system. Healthcare is being led by two groups. It's being led by consumers, not patients, consumers, of which patients are a subset, and it's being led by technologists, that sort of unlikely group of geeks that are doing things that are extraordinary, and we'll talk about a few of those in a minute. It turns out that the same forces that are revolutionizing education in this country, for example, and have already revolutionized communication, journalism, publishing, travel, music, and in our financial lives, those same forces are now finally beginning to sweep through the world of health. They're finally gaining that power to transform whole industries in a world you live in every day and that has been largely insulated. In fact, one could argue that health and healthcare are the last people to the party, the very last. And they're just showing up while the party's getting hot. So where is the future of health and medicine if it's being led by consumer and technologist? I can show you where the future is because you know. Right? The future, of course, if I take it, is right here. There's the future. It's the phone. It's not anywhere else. It's right here. Why is the phone the future? Well, I'm a serial entrepreneur, which means that I have this dysfunction starting businesses and then instead of staying with them, going to the next business. That's a dysfunction in the real world. But I've learned that at the intersection of two places, a bit of it is going to come through this portable device. Every bit of it. Now, the device may change. It may become smaller. It may become larger. It may become flexible. It may become a throwaway. It may be worn in your clothes. But it is the on-ramp nonetheless. Remember, it was only 10 years ago, almost a click, where nobody in this room carried a cell phone. It was only a click where the idea that your cell phone could do more than just be a phone, that's only a few years ago. It's been only a click since data and text messages are so overwhelmingly common among young people that when you call somebody on the phone who's under age 25, their first reaction is, "Why are you calling me?" They're irritated. You've interrupted them. And I said, "Excuse me, I thought it was a phone." And they say, "Why don't you just text me if you need something? Why are you interrupting me? Why are you using this technology in an inappropriate way for the way I live now?" In other words, the world that was so comfortable and stable that we sort of understood, technology starts to disrupt, not because it's some new, more powerful thing, but because it changes how we want to live, how we want to behave, how we want to relate to others. And the way that you do that is in the on-ramp through the phone. So in the near future, when patients visit a doctor or a physician, the electronic health record isn't going to be on the doctor's side of the equation. It's not going to be on the practice side. It's going to be on the patient's side. Because when the patient leaves, the patient is taking their information not just from this interaction, but they have all their information. The simplest example might be if I came into the music store. There used to be stores that actually sold music for those of you that are under age 25. You'd go to a store and buy music. What a concept, huh? All right, but when you went to the music store, if you could bring all your you didn't bring all your music with you. You just bought new music, and then you took it home and put it in your music collection. But of course, today, when we shop for music, we're carrying all of our music with us, right? It's right here, and really it's not here at all, is it, ladies and gentlemen? It's all in the cloud. It's no longer in your handheld device. It's no longer on your computer. Fairly soon, it's up in the network. This is just the on-ramp. As we think about the first way this device makes the world different, what I'm telling you is this device doesn't contain the information. That's silly and unnecessary, and you could lose it. Not useful. This device is the on-ramp to the information. Second, this device is your lifeline. I mean that in a metaphorical sense, though for some people it will be much more than metaphorical. The lifeline means it's the thing that I turn to when I need something. Like the old television show where you would use a lifeline to Who Wants to Be a Millionaire. The lifeline says, it's my first place I go. Why is the phone the first place I go? Because it connects me to my friends, it connects me to my family, it connects me to the expert I trust. It might connect me to my physician if he or she will take my call. It might connect me to a wellness provider. It might connect me to a caregiver. But it's going to connect me to somebody. And my lifeline is in my pocket or purse or its successor device. So the second thing here is the fact that this device, this pathway, whether it's your pharmacy, whether it's your parents, or whether it's your friend who you happen to know also has a similar condition to what you're experiencing and would like to talk to, this phone is where it's going to happen. The last and biggest reason why the phone is going to be, and the phone, of course, is now a mislabeled device, all right, why this device is going to be so critical and central to the future of health and health care. It's the wetware. Nobody ever called me wetware until I was in Silicon Valley once. And the software, which sits on the network. Software, of course, is all of the computerized instructions and processing power that we use in program environments. Right now, the wetware isn't connected to the software except through the brainware. But that's going to change, and it's going to change fast. Fairly soon, and I mean within a few years, and it's of course already happening with some of the earliest devices that you wear on your wrist or wear on your belt, but fairly soon you're going to have non-invasive sensors that are like Band-Aids or woven into your clothes or swallowed as nano devices or implanted if part of chronic disease management. And these non-invasive and in some cases modestly invasive sensors are going to change everything. And they're not going to change everything because of the quantified self movement, though the quantified self movement is the leading edge of that. They're going to change because finally the data set about what's happening in the wetware, in you, is going to be available to the network. And if we have learned anything in the last technology, we have learned that the data set connectivity changes everything. Our ability to check our email anywhere is very different than our ability to check our email sitting at a desk. Our ability to use a phone anywhere is totally different than our ability to use a landline when we're sitting near a handset. Our ability to talk, to think, to interact, our ability to post on Facebook and in a second have 600 different friends be updated for free, what we're thinking, doing, feeling, desiring, for free, has attracted 1 billion users. 1 billion users in just 5 years. Imagine if those billion same users could connect their wellness, could connect their health in a way that suddenly made the software capable of accessing what is really going on in our A1C, or really going on in our HDL, LDL, or any of the other terminologies that no consumer would ever care about, but ultimately wants to know the results of. So these biomarker revolutions are not only going to be reactive, they're going to be proactive. Someday my phone is going to ring and it's going to say, Jay, you need to head to the hospital now. You're about to have a kidney stone. I've had 5. Trust me, bad idea. Okay? You're about to have a kidney stone. And let me tell you, ladies and gentlemen, I'm in the next cab to the hospital. All right? All right. I probably won't be answering the phone because I'll be thinking it's a call, but unfortunately it'll be a text message. So the power of prevention to be embedded into the network is not simply a reactive power, it's a proactive power. Ladies and gentlemen, this is not science fiction. It's not science fiction any more than downloading new apps or new software operating systems to your phone is science fiction. This is things that are happening the day after tomorrow. Right? This isn't just a solution that I'm describing. It's a complete redefinition of the problem. In other words, the problems you are working on, in large part, are the result of a way of thinking about health and healthcare. And that way of thinking is the way you grew up. It's the way you were trained. It's the way you practiced. It's the way you assumed that the world was going to be tomorrow and the day after tomorrow. And I'm telling you, it's not going to be that way. Yes, we can say with certainty that chronic illness is going to be the dominant health issue of the next 30 years, if not longer. We can say that with certainty. But what we can't say with any certainty at all is why and how our behavioral attempts to manage and cope with those illnesses are going to be completely changed, because we are going to be using tools and using processes that aren't invented yet. They've barely been conceptualized because it's changing that fast. So, if all we do is connect everyone to, we're going to have better connected but badly behaving chronic disease. Because we've learned anything about chronic disease, we've learned it's about our behaviors. The vast majority of chronic disease is a result of a lifetime of bad choices. Of choices that we either didn't understand, didn't care about, didn't want to know about, but now ultimately have to pay the bill for. Whether it's inactivity, whether it's foods we choose to eat or not eat, or whether it's stress levels or lack of sleep, or you pick it, that together creates the disaster of the modern chronic disease world we are now beginning to experience. You know, as a group, you know better than anyone else that we can't afford to keep going the way we're going. But you're working, if you will, on the left side of the ledger. You're working on how do we integrate better? How do we get better evidence? How do we get better and more efficient systems? How do we make sure that the things we do are worth doing? How do we work as teams together much better than we're working now? How do we deal with changes in law and policy and at the same time do our jobs that we have to do because we're in the trenches having to deal with it every day? Happen on one side of the ledger. But what's happening on the other side of the ledger? You see, on the other side of the ledger is human nature. And that's both good and bad. You see, human nature is how the customer/patient behaves. And for the longest time, human nature in health and healthcare used a very simple model. If I'm not sick, I'm healthy. If I'm not sick, I must be healthy. When I get sick, I go to the doctor, and they make me healthy, and they send me on my way. That's the model that hundreds of millions of Americans have. That model ain't going to work. See, that model's going to change because pretty quickly people are going to realize, because they'll be able to learn very instantly by looking at their phone, wow, I'm not healthy. I don't feel bad, but I'm actually not healthy. In fact, it says here that I have a 50% chance of dying before my son gets married. Now, you as doctors don't speak that way, but we as business people, that's what the app's going to say. 50% chance death before son gets married. That's very motivating if you really want to be at your son's wedding. Okay? I don't need to know my HDL-LDL ratio. I don't need to know my A1C. I don't need to know my triglycerides or any other matter. I just need to know I'm probably not going to be at my daughter's wedding. Not good. What could I do? Well, here's some ideas of things you might want to do. You see, I said human nature is the ally and the enemy. When human nature has us behaving badly for our own health consequences, we view it as the enemy. And when it has us behaving well, we view it as the ally. But here's something about human nature that we know at TEDMed, and you know too. It's constant and it's predictable. That means we don't have to reinvent human nature. We don't have to win a war. In fact, when we fight human nature, I can tell you who is going to win every time. Human nature is going to win. When we tell people not to eat that extra or not to have the foods they like, I can tell you who is going to win. Human nature. When we tell people that they need to get up and do an hour of aerobic activity pretty much every day, or else they're going to suffer problems later in life, I can tell you what's going to happen. They're not going to do it. Now, that's the bad side. Here's the good side. We can actually figure out how to work with human nature. That requires a multidisciplinary approach. That requires us to bring people into the discussion who are not experts like us in our narrow field or in any field. Human nature is an addressable topic when you're creative about it, when you're imaginative about it, when you can bring fun and joy and positive experiences, then suddenly human nature is your friend. You see, isolation and loneliness is one of the great challenges in America today. And I know because we've had a lot of discussion about it at TEDMed in our Great Challenges program. Isolation and loneliness lead to so many health problems, as all of you know. People who are isolated don't take their medications. They don't take care of themselves. They don't take care of normal preventative things. They're isolated. They become lonely, and loneliness leads to depression or symptoms like it. On the other hand, I just told you 1 billion people are on Facebook. Facebook is an anti-isolation force. It's currently more of a younger person's game. But that's just because we haven't thought about Facebook as the enormous social medical tool that it is. It's a medical revolution, Facebook, waiting to happen. Because on Facebook, suddenly you can be connected remotely to people asynchronously without having to talk to them on the phone right, in a real-time sense. You can bring people into a community that feel that they can keep up, be connected, be involved, and you can do it in a non-intrusive way for a cost of zero. Imagine an anti-loneliness campaign that could go global for a cost of zero. We put that right in the federal budget, $0. You see, the beauty of these tools is so many of them have been designed in the consumer space. So many of them have been designed to scale massively that we can use tools not because Google can allow us to do information searches in 0.06 seconds of 4 billion records. It can, but because we can connect to each other in human and real ways, for which the revolution is only a few years old. Fairly soon, I'm going to be able to see those people. You know, the picture frames that used to be on your desk that were static, they're going to be live. Those picture frames are going to be real-time connections. The ability to see what people are doing or had done a minute ago or an hour ago, the ability to see what your grandmother had for lunch and just give her a nice note and say, Grandma, it looks like you had some wonderful food for lunch. The ability to talk to somebody who says, you know, this thing, I think this medication is making me sick, and being able to say, well, Grandma, why is it you think it's making you sick? Well, I had it, you know, at lunch. Well, did you have any else at lunch? Well, I had a few drinks. Well, Grandma, that's probably what's making you sick. The medication and the drinks don't work. Okay, grandson, if that's what you say, I never had that before. Well, did you have anything? Yes, I did. I had a new vermouth. Oh, well, Grandma. Okay. You know, people are people. So we've already learned that people don't want to take a class. You know, they want to take a pill. But we don't want to give them a pill. What we want to give them is a framework to enjoy life and become healthier while they do. We want to give them a support group that allows them to see and feel a world that currently they cannot see and they cannot feel. We want to make human nature our ally. If 1 in 7 Americans are going to eat at McDonald's every day, then that's what 1 in 7 Americans are going to do. But McDonald's will sell the healthiest food in the world if it's profitable to do it. Absolutely. McDonald's will not only sell the healthiest food in the world, they will invent the healthiest food in the world if that's what people want to buy and eat. The challenge isn't how to tell people they're wrong. The challenge is how to tell them they're right and yet give them what is best as we as evidence-based scientists know. Which is not to say we're nannies. It's to say we're doing what public health and other professionals have always done. We've interpreted the science, informed the commercial and non-commercial communities about it, informed the churches and religious communities about it, and we've allowed a free society to take those best ideas and make them real for people and profitable for businesses. So there's no question we need a nation with more activity. But there's also no question we're not going to be a nation of people who want to sweat regularly. That's okay. Activity comes in all forms. Move. On the other hand, we complain about kids in video and sitting in front of screens and becoming obese or overweight. So we need to make those video games fun and exciting and moving in their process. And here's the good news. The good news is that the future of the world is social. And I'm not from Facebook. The future of the world is the tribal predisposition we all have. That tribal predisposition is in our genes. It's why loneliness and confinement is the worst punishment we give to the worst people. Because we recognize that there is nothing crueler than cutting people off from others. There is nothing more painful than being alone and unhappy. Right? We know, therefore, that whether it's a family unit, which is a modern term that's moving as fast as some people can deal with, or whether it's an extended family, or a group of friends, or a group of coworkers, or a group of people in my congregation, or a group of people in my military unit, or a group of people that I went to school with, or a group of people, you know, that you pick it, those social dimensions are now being remediated in real time with enormous fidelity, with all kinds of memory components where we can call back memories and ideas and events and things of common interest. We have suddenly reached this inflection point where we can be as we want all the time. Now you might say, who wants to be that social? And I would agree, many of us won't want to be that social. But that doesn't mean when we don't want to be social at all. It just means we want to control how social we are. As you move down the age scale, you find that the average teenager in America today, average, sends over 5,000 text messages a month. 5,000. This is a technology and a form of communication that did not exist 10 years ago. That's the opportunity. So, as we look at the future, and as I sort of wind it up here, right, we know a bunch of things that really matter. We know that the network will have its own on-ramp. We know that this phone is going to be a silly name. You know, if you ever want to have a good time, ask somebody who's what a dial tone is. What's a dial tone? They look at you like, I don't know. Okay? You know, you'd have to know what a dial was. And then you'd have to know what a tone is. And then you'd have to associate a dial and a tone with a phone. Okay? Makes no sense for most young people, right? That's how fast it's changing, right? But we know that the network, with its cloud storage, our information is going to sit on the network just like our electricity sits on the network. Most of us don't walk around with stored electricity other than a small amount in a battery. The rest of the time, when we need power, we get it off the electrical grid. When we need data, we'll get it off the data grid. The data grid sits out there. Why would I want to carry it with me? So we'll know it's coming through the phone. We'll know it's sitting on the cloud. We'll know it's driven by consumer applications. People are going to write apps for everything that you don't want. Every last thing you wouldn't want will be an app. Right? The patients will have too much wrong knowledge. They'll have too many anecdotal errors. They'll have too many weirdos telling them alternate therapies that have no basis in science. All that is coming. They'll have simplified graphics that way oversimplify things. That's coming. All of that is coming. It's because the consumer/patient is driving the system, and the technologists are going to give them what they want. And no matter how much regulatory authorities might say, no, we won't allow that, we won't permit it, it will make no difference, ladies and gentlemen. In a commercial society like the United States, where businesses can move at the speed of business to satisfy consumer demand, whatever they might be, I guarantee you those demands will get met, regardless of whether or not we in the health and want them to be met that way. So we've seen the future. It's groups of various kinds. It's a network mediated through a phone, probably with voice commands, very little typing. You'll talk to the network fairly soon. And for those of you with iPhones and are struggling through Siri, just imagine in 5 years, it'll be much more like Star Trek than Siri. You'll talk to the computer network, and the computer network will talk right back. Right? We hear this all the time at TEDMed because we are looking for it. Right? We're looking for the future of health and medicine. But in this new mobile social health environment, I can tell you we're not that far ahead. We really aren't. We're just a few years looking a little bit further. In your jobs, and as you think about your future, the opportunities for population health management have never been better, because the population side of the equation is about to show up to the party. Yeah, that's going to be a problem, because you were having enough time with your side of the equation. I'm really sorry. Those silly customers, don't they know? Okay. They're showing up not by the millions, not by the tens of millions. They're showing up by the hundreds of millions. And if you think your health record is going to be the record they're going to use, think again. They're going to have their own health record, and it's going to be their own way and in their own style. If you think your assurances of what the right therapy is going to be the one they're going to use, think again. They're going to have their own network of social people who are going to tell them, don't pay any attention to those blank. I have the latest from blank that says what you ought to be doing. There's a reason why things like homeopathy are an extraordinarily powerful force regardless of evidence. Because you can find evidence if you're a consumer and you want. The placebo alone is good for a 17% evidence lift. We know that. Right? So, that's the future. I'm sorry, the equation just got more complicated. But here's the exciting part of it. There's way more opportunity to be disruptive. There's way more opportunity to reinvent the damn thing. There's way more opportunity to focus on the 98% of what it means to be healthy and prevent illness, while at the same time, there's way more opportunity to manage it, care for it, support it, and reduce the cost while increasing the quality of it. Thank you very much, ladies and gentlemen. I'm happy to take one or two questions if you do. You're welcome to speak on the microphone, and I'll repeat the question. And I'm just as fine if people say, oh my God, if I ask him a question, he's going to tell me something else terrible. Okay. So.
I have a goofy question. My son, who is one of those on the net all the time, just told me about the fact that the broadband is not broad enough, and that in fact there's a whole FCC sort of process going on right now about the fact that there isn't going to be enough whatever we use up there to host all of the.
So you can go home and tell your son no problem. So the question really was, are we running up against somehow limitations on the amount of information and data we can move so that ultimately we will not be able to move a lot of the data we want? And the answer is no. The really good news there. We're nowhere close to any kind of limitations. Most of the fiber in the ground is dark, for example. The compression technologies just make it better and better. The storage technologies are going through the floor in terms of the cost of storing it. So there is nothing on the horizon that indicates that we face any kind of limitations in either our ability to communicate extraordinary amounts of data across the network and or retrieve it and or process. So as many of you know, in the big data revolution, we're now just beginning to figure out how to take terabytes and terabytes and terabytes of data and in just a few seconds find answers that are hidden inside the data set. It's almost like doing epidemiology at light speed. We used to do epidemiology really slowly, whole countries at a time. Imagine doing epidemiology in an hour, in a minute. That's the future that's coming. So there is literally nothing on the horizon which indicates limitations are any part of our problem. And in fact, the commercial marketplace is so amazingly powerful. I mentioned text messaging earlier, but how many of you know that text messaging is a $250 billion business globally? $250 billion this year will be spent on a mode of communication that is 140 characters long, for which you cannot spell a single word properly, okay? Not one, okay? And takes up zero bandwidth for the carrier. Nothing. I mean, it's in the rounding error between two records is where you're communicating text messages. So that gives you a sense of just how extraordinary the times we're living in are. Any other questions? Okay, pardon me. So I have some very surprising news there. So the question is, as consumers show up, not just patients, but as consumers show up, which is the larger segment here of the total pie, how do they think about privacy? So here's the answer. They couldn't care less. Couldn't care less. We at the affluent edge of the marketplace really care about privacy. Privacy is correlated to age and affluence. The more money you have, the more you like privacy, as a general rule. And the older you are, the more you like privacy. The younger part of this thing says, get over it. That's so stupid. What do I care? And Facebook is a living example of the power of non-privacy. Because if you ever go on Facebook and see what people are putting it there, it's so incredibly personal and stupid, okay? You just go, why do I want to know what you just had for lunch? Why do I want to know, the abbreviation of TMI, which stands for too much information, that's what older people say when they just don't give me all that information. But as the younger people move through, as the young cohort moves through the system, as the digital cohort ages, and they don't even want it in healthcare, with the exception of when they're concealing issues that they consider, and fewer of these issues that they're trying to conceal. But short of active concealment, privacy is a very, very small issue. Now, unfortunately, privacy and HIPAA which, it's really wonderful, HIPAA, which is an act that nobody can name, defining a policy nobody can understand for a problem that nobody really can explain, okay, right, is sort of the bugaboo for, I think it's the Lawyer Employment Act, which says, we can't do that, HIPAA. Nobody knows, just say HIPAA. It's like saying hippo. Okay, HIPAA, we're done, okay? Okay. I had a bunch of people come visit me who, like, run HIPAA. They could say, the truth is we can barely explain it, and we're from HIPAA, okay? They were from the government. It's like, I said, we could do a TED Med talk about that because it's sort of important because it's acting as a massive brake on innovation. It says, well, we can't do that. We have all of these rules and we can't allow information to move. Why? HIPAA. Okay, that's crazy. Okay, so bad. Anyway, I would just warn you, the thing I've learned about HIPAA is that it's a paper tiger except with the lawyers. So if you look at what the Act actually says and requires, you can do almost everything a human would actually really want to do with very little requirement. We've over-lawyered it, just like we've pretty much over-lawyered everything in the West. And unfortunately, when it comes to medical and lawyering, we have the perfect storm. So, yes?
I wonder if you could talk about in social networks the boundary between knowing someone face-to-face and knowing someone virtually. Is that breaking down?
How is the breakdown, is there a changing relationship between knowing somebody physically and knowing somebody virtually, and what has been happening as those worlds start to meet and change as we move forward? And the answer is yes. There's obviously a fair amount of research going on in the field, but here's what I experience anecdotally. I think it's now 1 out of 3 or 4 people who are getting married have met online. They actually met virtually. When you meet your spouse online, it changes your whole attitude about online. It really does. Now, it doesn't mean you don't meet them personally. Of course you do. I suspect there's going to be a significant blurring as we move forward between the idea of real and virtual. I mean, so much so that you will feel you actually know somebody. I mean, we're only at the beginning of 3 dimensions, of a sort of holographic projection. But it's relatively soon before you're going to sit and be able to talk to people. If you've seen some of these virtual teleconferences, they're just so good. And there's another evidence that says this too, which is you can train to be a pilot in the United States and fly you can get a license from the FAA to fly a 747 where the first time you ever set foot in a plane is with passengers in the back. So let me say that again. You can get a license to fly a 747 on a commercial airline where the very first time you have ever stepped in a plane is with passengers in the back. Simulation technology has become. In fact, the simulators are so much better than reality because they can simulate all the problems. And you can see, of course, how this is going to work in health and medicine. These simulations are so good that they become real. In fact, engineers have a saying that I believe reality is 16 million polygons a second, okay? Which means that 16 million shapes per second coming at you, that is what your brain perceives as reality. And as we know from movies that make us cry, we're not a problem to ourselves in the world. So I suspect that the video game and digital generation is shifting their sensibilities in what it means to meet somebody physically. Now, I don't doubt that they are not replacement choices here. I mean, we're not. I don't believe the virtual world is going to replace, in any sense, the physical world. I just think it's going to become a rebalancing act, and that rebalancing is going to become more and more real to us because, other than pheromones and maybe smell and sense, I mean, who knows? You have haptic technology, which makes you feel like you're shaking or touching something. There's so many ways to fool the brain into thinking you are with someone that I suspect that those ways are going to continue for quite a while. And in 50 years, we're going to look back and go, wow, did you believe they got on airplanes and went to meetings? I mean, what a concept. Why the hell did they do that? Okay. So time for one last question if anybody has one. Let's see, am I missing anybody? Okay, well, I want to thank you all, and it was a pleasure to be here and address you. You are welcome.
I have a new favorite quote. The opportunities for population health are expanding because the population is about to show up to the party. I think we're going to use that a lot in the future. Thank you so much, Jay. I really appreciated your thoughts and your guidance for us going forward. This has been an incredible 2 days of information, of learnings, of networking, and collaboration. I hope that you'll take this and go forward back to your organizations, back to our CCA meetings and events and work with us to continue to evolve and grow and expand and lead on behalf of this industry. I would also like for you to mark your calendars. October 23rd through 25th, 2013 at the Fairmont Princess Resort in Scottsdale, Arizona, where we can continue this conversation and recognize additional leaders in our organization and our field. Thank you so much for joining us here in Atlanta this week. I look forward to your feedback as we continue to improve this conference. I thank you for your support, and I look forward to working with you. Thank you.